Alrighty, welcome and thank you for joining. My name is Angelica Cardenas and I'm a health educator for community health at Atlantic Health System. Today's webinar, What You Need to Know About Sepsis, is presented by Susan Higgins, Project Manager in Quality and Patient Safety at Overlook Medical Center. Before we begin, I have a few announcements. This webinar is being recorded and all participants are muted. If you have questions, please use the question and answer button for questions or the chat button for comments. We will try our best to get to all the questions at the end of the presentation. Are you or a loved one interested in smoking cessation? Atlantic Health System offers a free quit smoking program. This program includes an individual assessment, free nicotine replacement products, and 6 weekly group meetings to help you quit and stay smoke-free. There are multiple dates and times available, with groups available in person or virtually. For more information about these groups and other resources, or for additional dates and times, please call 1-844-472-8499, option number 3. And now I will turn it over to Susan.
Thanks, Angelica. Good afternoon, everyone. Thank you all for being here. I am especially glad that we are on Zoom today when it is like Arctic temperatures outside. So I hope you're all home, cozy and warm. I am Susan Higgins. I'm a nurse at Overlook Medical Center, and I work in quality and patient safety. I'm going to talk about sepsis today. You may have heard about it. It may have affected you or a loved one. As a nurse, I've cared for many patients with sepsis of all ages, backgrounds, some who have already had health problems, and some who are otherwise healthy before they experienced an infection that overwhelmed their body's ability to fight it off. When I started working on sepsis, I didn't think that this was going to be something I'd be passionate about. But a few years ago, it actually became personal for me. My dad, who was 87 at the time, had been complaining of just some vague chills that would come and go, some vague upper abdominal pain. And when it finally got to be very bad, we talked him into going to the emergency room, and he had a septic gallbladder. And let me tell you, at 87, he spent the next year in and out of hospitals and rehab. And I am glad to say that he is 90 and going as strong as ever. But it really showed me personally, not just as a nurse, just how much this can affect someone. There are some misconceptions about sepsis. So there are some misconceptions that it doesn't happen that often, that it only happens to the elderly or to those who are already sick, and that sepsis is easy to treat. And those are not true. Sepsis is the leading cause of illness and death in the United States. 1.7 million adults get sepsis every year, and 25% of survivors are rehospitalized within 30 days. A large part of our healthcare spending is on sepsis, nearly $62 billion a year. The longer it takes to get someone to treatment, the sicker they become, and it's not easy to treat. Up to half of all survivors will continue to have problems related to sepsis. Also, excuse me, I'm still trying to slide through the slides. There we go. Sepsis can happen at any age. It's not just for the elderly. It can happen to postpartum moms and kids of any age. I did once take care of a otherwise healthy 18-year-old who got a cut on his arm at the gym, and it became necrotizing fasciitis. He became terribly, terribly sick with sepsis, and he did actually have to have the arm amputated. Sorry, I'm still trying to get through the slides. I don't know why. Can you do next slide, please? Thank you. So what is sepsis? You may have heard it go by another name: blood poisoning, septicemia, bacteremia. And sepsis is when an infection causes your immune system to have an extreme and overwhelming reaction to the infection. Early signs are fever, rapid breathing, and fast pulse, Later signs include a large drop in your blood pressure, altered mental status, organ failure, and eventually death. More common causes are respiratory and urinary tract infections, but it can be caused by meningitis, cuts or skin infections, infections around any indwelling catheters, for example, a catheter for dialysis or outpatient IV medications. Any infection from any cause has the potential to become septic. And like I said, sepsis can happen at any age and from any, any kind of germ. It is higher risk for anyone who has a compromised immune system. So the very young and the very old, people with chronic health issues, including those who are on immunosuppressive medication like chemotherapy or anti-rejection medications for transplant patients. And pregnant or postpartum women are also at risk. Unfortunately, there is still a lot of inequality in identifying treatment and surviving illness in our country. These are only some of the statistics of the disparities found in sepsis care in the United States across all ages, socioeconomic groups, and backgrounds. Minorities and people of color are disproportionately affected by sepsis. They are more likely to become septic, less likely to receive timely treatment, and more likely to die. So here at Atlantic Health System, we work to combat these inequalities by listening to the people in our community and identifying their needs. We receive training on diversity and inclusion, identifying internal biases, and providing patient-centered, culturally sensitive care. In addition, every AHS patient is assessed for their individual needs and concerns, such as access to healthcare, transportation, food insecurity, and that they have a safe home environment. Sepsis starts off with the symptoms you'd expect from any infection: fever, chills, aches. If you have a respiratory infection, you might have cough and congestion, a skin wound that's turning red and warm, a urine infection that's getting worse and causing flank pain. Maybe you've been to the doctor, received treatment, and it's getting worse. Especially if you're a caregiver for someone who can't tell you what's going on. So say a very small child or an elder with dementia, you might see someone who's just not acting like themselves. We hear that a lot when they come into the ER, that they just don't seem right. It might be a baby who's too tired to eat, isn't going through as many diapers as they usually go through. It might be a patient with dementia who's normally alert and responds to their name, and now suddenly they're lethargic and they no longer respond to you. That's when it's time to go to the hospital. And again, the sooner treatment is started, the better off for the patient. When you arrive at the hospital, sepsis is an emergency. So don't be afraid to say, I think I have sepsis, or I'm worried about sepsis, and why. Be prepared to give your health history, including any medications you take or if you've had any recent infections. When you're sick and you're stressed, it can be hard to remember your information. And so, I encourage people to put down this information, what medications you take, your health history on a card to keep in your wallet or purse, or take a picture of it on your phone, so that you can access it easily and remember anything when you're at the emergency room and they're asking for all your information. If you're a caregiver, also have that information written down on your phone, or in your wallet, again on a card, so that you have access to it when you might be too stressed out to remember everything. When you're in the emergency department, they may order blood work, IV fluids, antibiotics, and if your blood pressure gets very low, they may order IV medication to keep your blood pressure up. After discharge, up to half of all survivors continue to have physical, cognitive, and emotional problems related to the sepsis. It could be trouble sleeping, difficulty concentrating, joint pain, mood swings, and depression. And once you've had sepsis, you remain a high risk for getting sepsis again in the future. So if you need medical care, afterwards, be sure to tell the provider that you have had sepsis, and what your symptoms were or what happened when you had sepsis. Follow up with a healthcare provider is very important. Again, up to a quarter of all sepsis survivors will be rehospitalized within 30 days. Um, Before you're discharged, make sure you understand your discharge instructions. Your healthcare team will be reviewing them with you before you leave. Make sure you understand who it is you're supposed to follow up with and when you're supposed to have that follow up. And if you have problems before that first appointment, know who you should contact. Um, you know, uh, Make sure you know what medication you should take, especially if you've been prescribed any new medications upon discharge. Um, Recovery can take a while. Again, my dad, it took him at least a full year to really start to feel like himself again. He was very weak for a long time. Um, he was in acute rehab for weeks. He got physical therapy afterwards at home. So if someone's telling you like, that, you should have physical therapy or they're going to arrange physical therapy for you, take advantage of that because, you're really going to need to, especially if you've been in the hospital for a while, to build up your strength again. And of course, it's important to, eat healthy, stay active as you can, and see your doctor regularly. Next slide. Oh, there we go. The first and best step you can do to prevent sepsis is to practice good infection prevention. Our sepsis committee works closely with our infection prevention committee here at Overlook. And especially now, we're right in the middle of flu and respiratory virus season. You want to make sure that you practice good infection prevention. Ever since COVID, I did work on the front lines during COVID. I've gotten into the habit that when I come home from someplace, the first thing I do is wash my hands. Um, when I am at the gym, I frequently use hand sanitizer or I use the wipes that my gym has like disinfectant wipes to wipe down the machines if you want before you use them. Um, I used to work with transplant patients and I would tell them Lysol spray is great, especially if you have a sick family member. Um, to spray on surfaces that are frequently used, to spray on doorknobs, just, in the bathroom, the kitchen, kills just about everything. And of course, get vaccinated. If you have chronic health problems, follow your healthcare regimen. If you want to learn more about sepsis, there's some great information at the CDC and the Sepsis Alliance websites. Myself and our sepsis committee, and I know the nurses here take advantage of the Sepsis Alliance because they also have a lot of good information for healthcare workers. But they do have a lot of information for survivors, families, caregivers, and it comes in multiple languages. So sepsis.org, just a ton of information there if you're interested. They also, every September is Sepsis Awareness Month. They do have what's called the Sepsis Superhero Challenge, where you walk, run, swim, or bike a mile to raise money for their programs. It does not have to be done all at once. You could, walk for a month and, help the Sepsis Alliance raise money. Here at Overlook, some of the things that we have started to just improve our knowledge of sepsis with the staff and the providers. We do a lot of education with the healthcare, with the staff and with the providers, the hospitalists, the ED docs. And we have started a sepsis champion program for nurses, so that way they can learn more about sepsis and be a resource on their unit, and also a champion for their patients. We are doing research with our clinical pharmacists to improve treatment for sepsis. We share our data and outcomes regularly with senior leadership, who provide us with a lot of support for what we're doing. This past November, we had our first sepsis symposium with educational offerings for the workers here. And we had a panel discussion with sepsis survivors and family members who had been impacted by sepsis. And it was really powerful. I think it was probably better received than all the other talks we gave that day, to really hear people who had been directly affected by sepsis, and they shared their stories with us. Um, we hope to continue working with community health. We really want to get out there, get some more community programs to get our message out to people in the community about sepsis. So more of that to come, hopefully. Uh, I would just like to thank Angelica for asking me to speak today. I'd like to thank you all for coming out.
All right. Well, that concludes our webinar for this afternoon. I want to thank everyone for participating, for attending today. We will ask for your feedback on this presentation. There's a link that will pop up on your screen when we close out the meeting. Please uh, fill out the survey. And a special thank you to you, Susan, for dedicating your time and your
Thank
expertise
you.
with us today. If folks have additional questions or comments, you're welcome to send an email to communityhealth@atlantichealth.org, or you can call our line at 1-844-472-8499. That concludes the webinar for today. Thank you, everyone, and have a good rest of your day.
Thank you.